We have a safety alert about a deadly drug that officials say is now in South Carolina. It's called cychlorphine, and it's a synthetic opioid. Doctors and lawmakers are very concerned about this drug because it's 10 times more potent than fentanyl. In the Knoxville area, it has been linked to at least 40 deaths in the last year alone. To help us understand this drug so you can better protect your loved ones, I'm joined by family Dr. Bijoor from Oakview Medical Associates. So thank you so much for being here.
Thank you for having me, Kari.
It's a very important topic for families across the country, but also here at home now that it's here in South Carolina. So what is this synthetic opioid?
So we have a dangerous shift now in the opioid crisis. You know, we know fentanyl is responsible for majority of the overdoses. Now we have a new player, which is a synthetic opioid. It's lab created. It's not a prescription, not a control, not regulated in the US. It's made by illicit labs, and it's being added or contaminated with the other illicit drugs now. So it's a real concern.
And do we know where it's coming from?
We know that it's being produced either in the United States or outside, but it's not something that's found in a prescription. So people that take to illicit street drugs can often be misguided and unknowingly take something that, you know, they don't know has been contaminated with this.
Now, Narcan has been a lifesaver for many people who have taken fentanyl. How does that work with this medication?
So this is far stronger than fentanyl. Cychlorphine is known to be deadlier, more rapid onset in action, and is responsible for pretty much immediate fatality if not intervened. So Narcan is still used, but you might need multiple doses. The effect of naloxone may wear off before the effect of the drug wears off. So, you know, it's a real concern now.
What happens in the body when you take this drug?
It causes a rapid slowing of breathing and stopping of breathing. So it can stop your respiratory center. It can also cause sedation, a rapid sedation like drowsiness, and also loss of consciousness. And all this can be rapid in a matter of seconds to minutes.
And that's why you can pass away from it.
Yes, yes.
Can it also cause serious addiction?
It can. I think, you know, it is an opioid. It's an analog of an opioid. So we know that opioids have a very strong dependence and abuse potential. So that's a real concern.
Now, as a doctor, what do you think lawmakers and other people should be doing right now to help prevent the spread and protect people here in the Carolinas?
I think broadly we have a couple of things that we must take, you know, action responsibly. One is raising public awareness that there is zero room for any error here. If any person takes to a street drug or takes something that a friend gives them, then you pretty much, you know, all bets are off. You don't know what you're getting. You could immediately, you know, have a very strong overdose effect and pass out. So public awareness is really important. The second is Narcan access, naloxone access. I think they can improve access in public spaces, just like we have the AEDs. We could have Narcan available. We could have schools have access to it. You know, if you suspect overdose, it can be easily given to somebody. And I think just also mental health access is important. You know, people that take to drugs usually have some form of mental health issue going on. So as physicians, as a public, you know, community, important to communicate and make sure they have access to the right channels to see physicians. A lot of people, you know, say they just cannot focus or they cannot concentrate, they're in pain, and they take to street options. If they would see their physicians and providers and have better access, treatment access. Also, this drug is not picked up on routine blood tests very easily. So being able to have better detections in labs, I think making labs more, you know, aware of these other non-traditional opioids is a good way to pick it up, because we don't, in the office, we can't pick up such other drugs. So that's important.
All right. Well, thank you so much for breaking all of that down, explaining it. I think it's something that will be in the headlines more and important for us to pay attention to.
Thank you for bringing awareness. So.